It is open to colleagues from all different groups. And and it is recorded. So I just wanted to make everybody aware of that. Thank you, Senator Spade, for organizing. We are ready to go.
Senator Spade. Fantastic. Thank you, everybody, for joining. And thank you for ISG, for staff for coordinating this, and my team, Andrew and Emily in particular, for helping set this up. Today we have the profound privilege and honor of being joined by Dr. Jiaying Zhao, and she's an associate professor at the Department of Psychology and Institute for Resources, Environment and Sustainability at UBC. She's the Canada Research Chair in Behavioral Sustainability and the UBC Sauder Distinguished Scholar. Let's just put it this way. She has a ton of expertise. And the day that I first was meeting with her, she was actually in NASA getting some grant to do God knows what. Sorry, excuse my language. But anyway, I've done amazing work. And the reason that we got connected is Dr. Zhao has been doing the research into cash transfers in BC, in particular with homeless folks. And for those of you who are interested in more work, I'll hold this up so you can see. One of the most recent books that she has been responsible for editing is called Cash Transfers for Inclusive Societies, a Behavioral Lens. In addition to doing the work around this area, she's also been involved in giving advice to us on terms of our Bill S-233, the framework for a guaranteed livable income, and that research and input has been invaluable. And so today she's agreed to talk a bit about many of the issues that some of you have been raising, both within the ISG, but also all the groups within the Senate, and that have been coming from the public in terms of some of the myths and stereotypes. And before I turn it over to you, Dr. Zhao, I wanted to just indicate this morning, just in fact, 2 hours ago, new from PEI, they have released the proposal for a guaranteed basic income on Prince Edward Island, a report, and so there's renewed interest in terms of this the major contribution that this study will make towards the importance of having a partnership proposal of the sort that 233 hopefully will introduce. And so I will encourage you, I'm happy to circulate that for anybody who would like to receive it. And without any further ado, I want to pass it over to you. Thank you very much, Dr. Zhao, for joining us.
Thank you. And we are trying to
okay, can you see my screen? Perfect. Thank you. I want to thank the Senate for inviting me today. I have the privilege to join you today from the unceded and ancestral territory of the Musqueam, Squamish, and the Tsleil-Waututh nations. So what I will be presenting is some of the facts and myths about basic income that I've encountered in the last several years. And the research I'll be presenting consists of my own work, as well as past studies from governments, NGOs, and nonprofit sectors around the world. So let's get started. I want to cover 7 specific myths around basic income. The first one being it's simply too expensive. So what this means is the recent estimate from the Parliamentary Budget Office, who actually did a pretty comprehensive study on a guaranteed livable basic income in Canada that's designed to provide individuals between the age of 18 and 64 with an annual income of $17,000 per person or $24,000 for couples. But this income would diminish for every dollar earned from employment. So it would actually reduce by 50% for every dollar earned. And so what this basic income program effectively would do is it will reduce poverty rate by 50%. And even for people on disabilities, they will receive an additional $6,000 per person per year. So this means providing a guaranteed livable wage for people below a certain income threshold. So this is actually income tested. And in fact, for people earning more than $34,000 a year, this program effectively disappears. So they no longer receive additional funding after that. So it's not the case that everyone in Canada will receive this income. That's actually a misconception. It's income tested, serving the lowest income bracket. And this will not affect children or seniors who are already receiving a basic income from the Canadian government. I also want to mention that the current spending on poverty in Canada is about $80 billion a year. So this is similar to this proposed guaranteed livable basic income program, but this again does not mean that we need to provide additional $87.6 billion a year to fund this program. In fact, as I'll get to in the later slides, a lot of the existing welfare programs can be reintegrated and improved and incorporated into this guaranteed livable basic income program. And that's another myth that I will get to in a second. Now, it seems like we need to spend a large amount of money, like somewhere around $87 billion a year on this, but actually that's not going to be the net cost. In fact, some design feature changes can significantly reduce this basic income program by up to 40%. And some of the simple design changes involve treating families. So this is a view of the census family. So if we can, let's say, view adult children living with middle to high income families as a family unit, and they don't receive benefit from this program, that will lead to cost savings right away. Another important factor I want to mention is there is actually significant social return on investment of this basic income program. And from a study done by the University of Saskatchewan, they actually used the same analysis from the Parliamentary Budget Office, and they actually found that there is 106% return on investment based on what the current estimates are. So in other words, every dollar spent in this program generates $1.06 in savings. So in other words, it's cost effective. It's actually net positive in terms of spending on poverty. And we've done a past cash transfer study involving individuals experiencing homelessness in Vancouver, BC, and we gave these individuals $7,500 as a one-time cash grant, and we tracked these individuals over 1 year. And what we found was these individuals moved into stable housing quickly after getting the cash transfer. As a result of stable housing, they relied on social health justice services less. And we quantify the cost savings from this cash transfer program. And it's actually, we found that every individual produced 110% return on this cash transfers because of the less reliance on social services. So there's actually a net savings of 10% from this transfer. Now, we are actively doing an expansion project at this point involving 400 individuals in homelessness. And we're more than halfway through in this project that's currently ongoing. And we actually found a greater cost savings from this program. And this time we're giving more larger cash transfer because of inflation and other increased social benefits. So now each individual is receiving $8,500, and we found an even bigger cost savings, which is 118% from reduced social health justice services from our participants. So in other words, basic income can actually save costs. It reduces the fiscal burden on the government because recipients become more financially independent and rely less on the services that we currently provide. So that's myth number one. Myth number two, that's probably the second most common feedback I've received, is basic income programs will discourage work. It actually will disincentivize work in the recipients. Now, here are the facts. In our previous cash transfer study, that's a small pilot that I'll start from, we actually saw the opposite. We saw a 77% increase in work hours in the recipients and a 50% increase in hourly wage after getting the cash transfer. This is remarkable. We did not anticipate this. And upon interviewing our participants, we found that this is because having moved into stable housing, they're able to put their children to daycare or school. They're able to get a used car and return to work. And that's the popular reason why they are able to work more as opposed to less after getting a cash transfer. In the expansion project, we saw even bigger results. We saw an 83% increase in work hours and 35% increase in pay after getting the one-time cash transfer. Now, an important fact here is the control participants who did not get the cash transfer actually reduced their work hours by 17% this is a period of over 1 year. So it seems like poverty actually saps employment or labor supply, and basic income can actually increase labor supply. Past basic income experiments in Finland, Manitoba, Alaska, California in the US have shown similar results. So what they have demonstrated is this is a smaller transfer on the national, provincial, state levels. They actually showed little negative impact on labor supply. This is in contrast to the PBO, as well as David Green, who estimated that the basic income program might reduce work hours by 1.5%. Now that's a very small percentage, but even so, past evidence does not support this reduction in labor supply. So there's actually zero change in labor supply after receiving a basic income. A recent review of 50 cash transfer and basic income studies around the globe actually show an increased labor supply after getting the basic income. This is consistent with what we find in our studies. So what happened there was, for adults, this includes men, women, they are able to increase work because of the stable financial resources that they have. The only subgroup that showed a slight reduction in employment was mothers with children, with people attending to the elderly, the sick, people with disabilities, and young people who actually chose to return to school after getting their basic income. So I think that's actually a good positive impact as opposed to a negative impact on society. And this is, again, I want to point back to in the Canadian context. After getting CERB, 60% of Canadians actually returned to work or found better paying jobs as opposed to leaving work with those CERB checks. The Ontario Basic Income Experiment, which was canceled around 2018, shortly after the cancellation, there is a rigorous study done with the recipients in Ontario. And they found that, so this report actually found that recipients were actually able to work more hours after getting the basic income. They continued to work with the CERB checks. Some took the opportunity to get better jobs with a higher pay. And there's also a proportion of people who actually chose to get retrained with education as opposed to continuing work with a lower paying job. I think that the fear that basic income might discourage work is unfounded based on past evidence. Basic income, in contrast, can encourage work, not discourage work. I think this is what the past evidence shows. This is what the recipients have told us and demonstrated themselves. So that's the second myth about work. The third myth is about misuse of money from basic income. So this largely comes from the stigma around welfare recipients. So what we found with our cash recipients was these individuals, even in homelessness, actually spend the money responsibly. They spent the money on food, rent, transit over 1 year. This is us looking at their spending data. Now, mothers with dependents actually spend more money on their children, on their food, clothing, and school fees. And this supports the going back to work argument so that they can actually return to work and work more hours. In our study, we actually saw no increase or no change in spending on alcohol, drugs, and cigarettes in our recipients after getting the cash transfer. This is with individuals experiencing homelessness, but again, there are screening criteria around that, which I can get to in a second when we have time. And we also found another surprising statistic, which was substance use severity declined by 90% over 1 year for these cash recipients who experience homelessness. What this means is that when people move into stable housing, they were actually used substance less and actually didn't need to use substance when they got their life back on track. So this is contrasting the pervasive view, which is people become homeless or enter poverty because of mental health or substance use issues. That's not necessarily the case. They use because they're homeless or they're poor, and not the other way around. And this is a recent review from the World Bank of 19 cash transfer studies around the world. Again, they show a significant reduction in spending on temptation goods. So these are alcohol and cigarettes. So this is, again, highly consistent with what we found in Vancouver. An ongoing basic income trial in the Cherokee Nation in North Carolina shows the same finding. This is a trial that the Cherokee Nations started in early 1990s, where they gave each tribal member $4,000. And in 2016, each tribal member actually received roughly $12,000 every year, adjusting for inflation. And over almost 2 decades or 3 decades at this point, they found that there's actually a significant reduction in alcohol and drug use, also in crime rates as well in this nation. So these evidence suggests that BI, basic income, does not lead to problematic spending of money. And actually, people are able to spend the money responsibly to improve their lives. So that's a third myth. The fourth myth is basic income will cause inflation. That's an intuitive as a perception of what additional cash would do. But the facts are the following. Basic income is unlikely to cause inflation because of these reasons. One is it does not involve printing more money. This is different from CERB and other kinds of cash transfers that haven't happened in the past. It's redistributing money in the system instead of creating more money. So this is one reason it's unlikely, very unlikely to cause inflation. Second is the supply of goods in our communities is likely to meet the increased demands, especially given the bottom income earners. So for these two reasons, inflation is highly unlikely with basic income. In fact, in Alaska, with the Alaska Permanent Fund that started in the 70s, the rate of inflation in Alaska has been consistently lower than the rate of inflation in the rest of the US after implementing the basic income program. Another concern or myth is, well, basic income might increase rent because the money is going to the landlords instead of the tenants. So the tenants themselves are not getting benefits. This is, again, not true because not everyone will spend all the money from basic income on rent. In fact, they can spend the money on whatever they want. That's why it's unconditional on other basic needs, including food, clothing, transit, etc. So for those reasons, again, just in theory, basic income is unlikely to increase rent. Now, in practice, we see the same empirical result. In Manitoba, there's a portable housing assistance where the money goes directly to the tenants as opposed to the landlords. And there was actually no increase in rent after receiving or the recipients receiving the basic or the supportable housing benefit. If anything, there's a slight increase in the quality of the lowest income households with the lowest cost housing, because now landlords are motivated to renovate the housing condition or the apartments for tenants who can now afford rent. In Vancouver specifically, where the housing market is a nightmare, basic income can actually stabilize rent because tenants can afford rent instead of moving out. And this is what landlords have been doing here in other cities as well is they kick the tenants out, and every time the tenants leave, this is when the landlords can raise the rent. So by turning over tenants, landlords can increase rent, and that's partly why rent has skyrocketed in Vancouver.
I'm sorry to interrupt, Dr. Zhao. We may need to speed up a bit because I know that people already are indicating they have questions and we have some time limits. So.
Okay, great. So bottom line is basic income is unlikely to increase rent. Another myth is the interaction between basic income and existing social benefits. And the fear is basic income will eliminate social assistance. That is not true, because the principle of basic income is not to leave people worse off than they are now. Basic income cannot replace the goods and services offered to meet particular needs. For instance, people with disabilities like healthcare, job training, education. Instead, it provides additional cash supports. And that can replace some of the existing cash transfers like the income assistance or GST credits. And more importantly, basic income can decouple the income assistance from goods and services from people with disabilities, which is currently the case, that these PWD and these goods and services are coupled for people who are unable to work. Whereas basic income can decouple that relationship, allowing people to work more while still receiving benefits. And finally, basic income can reduce the administrative costs of running multiple social assistance programs by simplifying and streamlining the cash transfer programs. Another myth is basic income cannot reach the most marginalized who do not file the tax, for instance. So basic income can actually reach both people in and outside the tax system in the following ways. We can include those who do not file taxes by providing them, let's say, ID replacement services so that they are included in the financial system. Another way to include people outside the tax system is the automatic tax filing for low or zero income tax earners or income earners, so that they can actually receive the basic income benefit. Okay, the last one I'll get to is how does existing targeted programs compare to basic income? In fact, we should do more of the targeted programs instead of BI to improve welfare. That's a myth, because targeted programs categorize people into arbitrary groups that people don't naturally fit. And this creates errors and mistakes and leading a lot of people out of the benefit programs. So there's actually a growing number of marginalized Canadians who fall through the cracks with the existing targeted programs. There's also significant stigmas associated with targeted programs. That leads to avoidance. By avoidance, I'm meaning low take-up rate. So in OECD countries, more than half of the eligible individuals don't take up social benefits. In Vancouver, for instance, more than half of the homeless population are not on income assistance that they qualify for. So that's primarily due to the frictions and the conditionalities and the stigmas associated with these programs. Targeted programs also have huge administrative costs around eligibility and conditionalities that can be prohibitive or humiliating in some cases. Now, this is my final slide. So what basic income can do is provide the financial supports to people without categorizing them in the first place. This is more parsimonious, efficient, and inclusive. It's also more cost effective because it saves a lot of money and time currently spent on categorization or proving or checking eligibility. Basic income has minimum conditions other than being a citizen or being a certain age group. It treats people with respect and dignity. It provides the financial freedom to allow people to decide what's best for themselves. And it reduces the overhead costs of the multiple targeted programs that exist so far. So the cash can be more effectively spent on people who need it. And finally, basic income allows people to be more free. They can now take up volunteering or provide care to others, go back to school, choose work they enjoy, as opposed to without. So with that, I'm concluding my presentations, and thank you again for having me today.
Thank you very much. And I know we already have one question. Senator Lafreda?
Thank you, Kim, and thank you for the presentation. I just have a question. How, and based on the experiments that have been done across the world, or and the results that we have, how might the implementation of a guaranteed livable income be expected to influence inflation? And we always say inflation, it was easy in the past. Scarce resources, excess liquidity creates inflation. Today you have geopolitical concerns, energy transition, reindustrialization. So there's a lot of factors to inflation. I know that. But when you're putting so much liquidity into the system, has there been a study as to what the effect on inflation is, and what strategic approaches could be employed to seamlessly integrate provincial benefits into this overarching system for optimal social economic impact?
Thank you, Senator. That's a great question. So the current ongoing basic income program in Alaska has shown the opposite. Alaska has a lower inflation rate than the rest of the US. So there is extra liquidity in the system, but it's not equally applying to everyone. It's actually benefiting again, as I said, the lowest income communities or individuals the most. And they will increase demand as a result. So I think this is the other condition is the supply of goods and services need to meet that demand. And in past cases, it has been the case, which is why inflation has now risen with basic income.
Thank you.
Thank you very much. And Senator Jaffer, and then Senator Omidvar, and then Senator Duncan.
Thank you very much for organizing this session. It's been very interesting, Senator Pate. I have a question. I'm also from Vancouver, and you said that, if I'm not mistaken, that 53% people who should be on income assistance are not accessing it. Is this because they don't have documents and they just don't have any way to prove they are from wherever they claim they're from BC? What is the challenges?
Thank you, Senator. The challenge is mostly ID, whether they have ID or not. Most of them don't. And that's why we actually provide them with IDs first before they enroll into the study. That's the biggest barrier we find.
Thank you.
Okay. Senator Omidvar?
Thank you, Senator Pate, very much for organizing this important, Senator, and Professor Zhao for your deconstruction of this issue. In one of your earlier slides, you noted that Canada already spends $80 billion on meeting the needs of Canadians who are experiencing poverty. Can I assume that that figure is a roll-up of provincial, municipal, and federal programs?
Yes, this is nationally across multiple levels.
Okay, thank you.
Thank you very, very much for your presentation, and to all those who have also participated. I'd just like to make mention of one point that you didn't mention with regard to the Alaska Permanent Fund checks. A good portion, a large portion of those checks are spent in the Yukon. So the economic impact is very, very far reaching. When the Alaska Permanent Fund checks were at $6,000 and $7,000 US, that equated to a new snowmobile, a new vehicle, and significant shopping in the Yukon. Significant. As well as, of course, all of the other benefits to that check once a year. And the other thing I'd like to ask you to elaborate on is, in your studies, have you considered the economic, how a guaranteed basic income might work with a self-governing First Nation, where payments are, income assistance is handled by the First Nation or by Indigenous Services Canada, how that might intersect and how it might work? Has that been considered in your studies?
Thank you, Senator, for raising that point, a good point about the Alaska study. So we did not treat Indigenous participants differently from other participants in our study, but I do recognize that there's the incoming cash transfer to Indigenous folks on reserves. I think this is an opportunity to actually integrate the systems and especially tying services to the cash. For some people, I do think that Cash Plus is the best support for these individuals. So I think my understanding is that the cash grant to the Indigenous people is a lot larger than what we anticipate with the Guaranteed Livable Basic Income program. And I think this is not excluding, it's not exclusionary, but rather we need to consider how to integrate the GLBI into the Indigenous cash transfer program. I have not, so again, as I said, I have not seen a study that examines that integration, but I would love to see one.
And thank you very much for that question, Senator Duncan, because that's precisely part of the reason we've proposed a framework document, not, as some people have interpreted, and heaven knows I've contributed to that confusion because I really want to see a guaranteed livable income, but recognize a first step is to have the discussion. So Bill S-233 is a piece of framework legislation that would anticipate that. And what what Dr. Zhao has not talked about, and I don't know if you feel comfortable commenting, is you are having discussions with, for instance, the Mayor of Prince George and First Nations in British Columbia about the possibility, if there was this kind of framework, a possibility of looking at a demonstration model with First Nations communities. And I know
yes,
that
we're
Yukon is
actively
also
looking into
interested.
that. Yeah, absolutely, Kim. As you mentioned, we are actively exploring a demonstration project in Prince George involving a lot of Indigenous communities in this project. And Yukon is, I think Manitoba to some extent are also looking at that. This is all following the recent PEI announcement with their demonstration project. So there's a lot of provincial, even municipal needs around basic income, especially around Indigenous people.
Do you want? I know we're in a bit of a time crunch, but it looks like, do you have anything else you'd like to add?
I was just going to, the challenge is that there are, just as there are different in Canadian provinces, there are different situations with First Nations through Indigenous people throughout Canada. We have, and the challenge there is the federal government making contributions and how you administer that. And then there's the self-governing First Nations who keep their own rules and who deal with their citizens. So it's, there's many levels of government that have to come to the table, and persuading them to institute a program is very challenging. This was part of the commitment for a basic income in the Yukon, was part of putting people first. And I think the stumbling block is the levels of government.
Well, and it's part of why the framework process is so important from our perspective, and why we're having we've been having discussions with provincial ministers as well as First Nations governance at the national level, and as well as with municipalities, because that's really what the framework is about. I want to really thank you, Dr. Zhao, for doing this. Part of the reason we put this together is so many people were saying, these are the negative arguments being brought, and so we asked Dr. Zhao and a number of other national and international experts to look at these issues. And thank you very much for presenting this work, Dr. Zhao, and for taking your time out on early in the morning for you in British Columbia. So And we do have a recording of this. We're going to be posting it, so anybody who missed it is welcome to pick it up that way. There are slides that in dans les deux langues officielles that we make available that Dr. Zhao made available and showed. So thank you very much.
Thank you. No, thank you so much to our guests. Thank you, Senator Spade, for making this happen. And we will share documentation. And I'm sure, this is not the end of that conversation. And it's been very, very helpful. So colleagues, thank you for, I know we stretched the agenda a little bit, but I think it was both interesting and important in the work that we have to do. So thank you for staying, and we will see you all in the chamber in an hour or so. Merci.
Thank
Merci
you very
beaucoup.
much.
Mhm.